Welcome back, everybody, to Let's Talk About Sleep, the channel where we talk about sleep. As I always tell you guys, these videos are for educational purposes only, so they should not supplant or take the place of seeing a provider, okay, about these conditions. If you have any questions, please put them in the comment section below. I will answer and get to all of them. If you're so inclined, the link to my book is in the description box down below, as is all my social media down there as well. If you like this video, click like. Please share it with your friends and family. Please subscribe to the channel. And that being said, let's get on to today's video, which is in this I Am Tired series of videos. And again, going along this theme of narcolepsy, which I talked about in previous videos, we're going to go over one of the more, I'll say, controversial medications we use. So, you may have heard of Xyrem, Xyrem, or its recently released cousin, Xywav, Xywav, Xywav. Where these names come from, I don't know. But what these medications are, sodium oxybate, or gamma hydroxybutyrate, what they are is basically the date rape drug. Okay, so these substances, when used in much higher doses, much higher doses than what we would give in a clinical setting, they cause people to fall into very deep sleep. Okay, back in the 80s, or actually probably even still to this day, bodybuilders used to take a formulation of this same stuff. And the reason why is because when they take it, getting to this whole notion of deep sleep. So when we go into sleep, we have REM and we have non-REM. Okay, the naming is not very creative. In non-REM, so REM sleep is when we dream. Okay, non-REM, all right, there's different levels. There's N1 and non-REM stage 1 or N1, non-REM stage 2 or N2, non-REM stage 3 or N3. N3 is the very deep sleep. Very deep sleep, very hard to wake up from, okay? If you've ever had a 2-hour nap, let's say, and you felt worse after you went to bed, chances are you were in N3 sleep. Anyway, what's important is during N3 sleep, the body produces growth hormone, okay, which does what it sounds like. So bodybuilders used to take this stuff, this gamma hydroxybutyrate or sodium oxybate or Xyrem, and again, much higher doses. They would get this increased amount of N3 sleep, produce more growth hormone, and then that would help them with their bodybuilding. Okay. But what we're talking about today is using it in a clinical setting, prescribed by a provider, for narcolepsy. Okay. So Xyrem, it's a very high salt concentrated medication. All right, and it comes in liquid form. So patients will take it at bedtime, wake up 2.5 to 4 hours later, and take it again. Xywav is basically the exact same thing, but it comes in a low salt version. Okay, so it's a low. Basically, they say it's like having a bag of chips. Okay, as far as how much salt is in regular Xyrem, Xywav is 90% less than that. Okay, but in both cases, what it's doing is, so it's a weird medication, right? You take it at bedtime, then you take it 3 or 4 hours later. What it's doing is providing extra deep sleep for those 2 periods, right? So the patient will presumably get more of that N3 sleep in both periods of their sleep, okay, when they have this Xyrem on board. Normally what happens is when we go to bed, we get some N3 sleep in the first half of the night, and then really not much the rest of the night. The second half, we really don't get any at all. Okay, so in a normal situation, that's enough, and we go throughout our day and we're okay. Somebody with narcolepsy, though, their sleep is very disrupted, very chopped up, and they're not getting enough of this N3 sleep anyway. Okay, so what Xyrem does is it gives them kind of more bang for the buck. That's the way I kind of define it with my patients. So they're getting 2 very deep sleep periods. Okay, and waking up from that gives them more energy, they're better throughout the day, and if they have this other symptom called cataplexy, which we've talked about in other videos, that should be decreased as well. All right? So normally what happens is there's a whole big process of getting Xyrem prescribed, but once the patient gets it, as I said, it comes in liquid form. And usually the dosage is anywhere from 6 to 9 grams split into 2 doses. Okay, so the person will take, let's say, 3 grams at bedtime, wake up 3 hours later, take another 3 grams, go back to bed. Now, when I explain this to patients, the question is always, well, one, how am I going to wake up in the middle of the night and take this? And to answer that, it's very interesting. Xyrem has a half-life of only 30 to 90, 60, let's say about 60 minutes or so. Half-life about 60 minutes, okay? 30 to 60 minutes, depending on, who you are. So what happens is, if you know from other videos that I've made, the half-life is after that period of time is gone, half of the substance is still around. So if a medication has a half-life of, let's say, 30 minutes, right? By the 3.5 hour mark, it's basically out of the person's system. So they may be waking up anyway, right? They wake up, they take the second dose, they go right back to sleep, okay? And the same process happens again for number 2, okay? And so the waking up in the middle of the night, believe it or not, in most cases, not every, but most cases, the patients really don't mind that because, one, the medication is wearing off anyway, and 2, they would wake up always because they have narcolepsy, and that's part of this condition. And 3, they know how much it's helping them in the daytime. Okay, so getting past that initial weirdness of this medication, and then the fact it's a date rape drug, once a patient is past that, they actually do very, very well with it. It's actually probably one of my favorite medications to prescribe because it really can make a huge difference in how somebody functions and how they sleep. Okay, same thing with Xywav. Now, they're coming down the pike with a new once-nightly version, which instead of waking up and taking the second dose, person will just take it once at nighttime, and it's going to do the same idea. How that's going to work, it kind of depends on, or I guess it remains to be seen in real life. The literature shows that it's almost as effective, but time will tell on that. But that's coming down the pike. Okay, but that's basically how Xyrem works, or Xywav. That's how they work. Okay, so 2 very deep sleep periods. All right, maybe when the once nightly comes out, I'll make another video on that. But for those curious, that's basically the principle of it. Now that's for narcolepsy. They have gotten Xywav, so the low sodium version. They have gotten that approved for idiopathic hypersomnia. Okay, and to reiterate what that is, these are people who are champion sleepers, who don't wake up throughout the night, who sleep 12 hours a night, and probably by giving them extra deep sleep for a shorter period of time, their sleep is probably more refreshing, and they probably need less of it. Okay, or they feel better no matter how much they've gotten. Okay, so again, that's kind of a newer thing, but we'll keep an eye on that. So that's basically the principle behind these medications. Now, that's how they work. The side effects can be anywhere from dizziness, it can be sedation, it can be nausea, it can be appetite changes, it can be sleepiness, believe it or not, which is what we're trying to treat. Okay, but again, the biggest hurdle I find is patients. They feel weird about taking a medication like this, but once they get over that hump, they're okay. And with the regular salt version, Xyrem, having that extra salt, especially as somebody gets a little bit older and they already may have blood pressure issues, you really want to try to get the Xywav in that case. Okay, which is the low salt. So that's the video for today. Kind of an interesting topic. If you have any questions about Xyrem or Xywav or the once nightly or anything else, please leave it in the comment section down below. The link to my book is in the comments and is in the description box. And yeah, that's another part of these I Am Tired videos. So please click like, please subscribe, please share it with your friends and family. And until next time, sleep well.